Hi, welcome. My name is Claire McLaughlin. I'm currently a graduate student at Virginia Tech, studying human nutrition, foods, and exercise on my path to becoming a registered dietitian. Welcome to the class Nourish to Flourish for PCOS. I was so grateful to be able to partner with Emily Jacobs, a dietitian working with Virginia Cooperative Extension Loudoun, to bring you just some more information about women's hormonal health. So in this virtual little webinar, we're going to go over PCOS basics, a nutrition overview of generalized nutrition, as well as nutrition for PCOS, some modifications for physical activity and lifestyle, information about supplements and medications for PCOS, as well as some tips for self-advocacy. So first to go over PCOS basics. So polycystic ovarian syndrome, or PCOS, affects about 4 to 20% of women. And we do suspect that this number could be closer to that 20% due to so many women getting diagnosed later in life or being underdiagnosed. The symptoms of PCOS are irregular periods, acne, weight gain, insulin resistance, abnormal hair growth, as well as characteristically having benign cysts growing on the ovaries. The cause and etiology of PCOS is currently being discovered, but we do know that it's connected to different hormonal fluctuations or imbalances. We know that there's a genetic component and that it also comes with and may be caused by high levels of inflammation in the body. Another cause or corresponding factor with PCOS is insulin resistance, which is something we'll be touching on a lot today. So you might ask, with not knowing exactly the cause and having a myriad of symptoms, what is the goal of PCOS care? And that is overall improved quality of life, weight loss and maintenance, if that's something that the individual desires, as well as improving cycle regularity and decreasing some of those symptoms we talked about earlier. So first, we're just going to watch this very short video about insulin resistance. It's from the Cleveland Clinic, and I think it's just a great example of just demonstrating kind of the mechanism of this.
Insulin, a hormone made by your pancreas, is essential for life. Your body's main source of energy is glucose, a simple sugar that comes from the food you eat. Insulin is released when glucose enters your bloodstream to help glucose get to the cells found in your muscles, fat, and liver. When you have insulin resistance, those cells don't respond like they should to insulin. And when that happens, glucose can't efficiently be removed from your bloodstream or stored for later use. If those cells become too resistant to insulin, your blood sugar levels can become too high, leading to hyperglycemia. And over time, this can lead to prediabetes and type 2 diabetes.
So just recapping that video. So we saw that insulin is a really important hormone excreted by our body. And there's kind of two issues or differences that can happen for women with PCOS with insulin. The first is, as that video described, insulin resistance. So your body is not responding or recognizing that there's insulin, and the insulin just isn't working as well as it should to open the cell doors to glucose. So your body is not able to get the cells to get glucose into the cells, right? Which can result in elevated blood sugars. The other form of difference in our bodies that can happen with PCOS is high resting levels of insulin. So this also occurs for some women with PCOS in that they don't have insulin resistance per se, but just resting, the body shouldn't be making insulin, right? We're not eating food. We don't really need a lot of insulin in our blood because there's not food or glucose coming in that it needs to take out of our blood. So for women with resting insulin or high levels of resting insulin, the baseline of insulin is a lot higher. So that also comes with different complications and symptoms that we want to try to manage. So we're going to start by going over some nutrition recommendations, more general nutrition first, and then going more into nuances for PCOS or just women's hormonal health. As you've probably heard before, we really want to prioritize whole foods first. So this is just a beautiful slide of the different colors of different foods that we could start by prioritizing. So as with any different type of diet or lifestyle change, we really want to focus on consistency over perfection, right? We don't want being perfect to be the enemy of being good and really improving our diets and just our quality of life. So we want to focus on adding whole foods, fruits and vegetables of many colors, whole grains, lean proteins, healthy fats, especially like those fatty fish, avocado, nuts, seeds, as well as really focus on hydration, making sure we're getting water, making sure we're getting electrolytes replenished as needed. And then, as is generally helpful, we really want to reduce that fast food, processed meats, and processed foods in general. Really want to reduce fried foods and refined sugars. So now starting to go a little bit more into nutrition for PCOS. I created these little PCOS plates, which I think are just a really fun visual representation of how easy it can be to build a meal. So the two main goals with PCOS are going to be to have half your plate being fruits and vegetables, really focusing on prioritizing those non-starchy vegetables, so leafy greens, squash, zucchini, green beans, carrots, all of those are great. And then we're also going to try to aim for 30 grams of protein per meal. This number might be a little bit more or less for different people, but for most women, 30 grams of protein per meal is a great place to start because if you're eating about 3 meals a day and maybe like one or two snacks, you're already getting at least 100 grams of protein, which is really great for muscle building, curbing your satiety, right? Increasing fullness, and then also hormonal health as well, really like stabilizing that blood sugar as well. So, really want to prioritize eating a multitude of different foods, whole foods, but your meals can still be fun, right? Like we have some salmon tacos, and we have over here we have like a curry with shrimp. So really trying to find ways to make colorful, balanced, but still really delicious meals. Okay, so foods to focus on. As I just kind of touched on, we really want to focus on those non-starchy fruits and vegetables. Really want to prioritize fiber. So certain fruits and vegetables are going to have more fiber than others. Berries, for example, are a really great source of fiber. They also are have a relatively low impact on our blood sugars. So for women struggling with insulin resistance or those who have that high level of resting insulin, as we talked about, berries are a great fruit to incorporate, as well as fruits like apples and pears have fiber in them, which is wonderful. Looking at kind of those non-starchy vegetables like cabbage, cauliflower, eggplant, green beans that are a little bit more substantial, right? Of course, our leafy greens are fantastic, have a lot of antioxidants, vitamins, and minerals, but really just prioritizing a variety of foods, and enjoying what you eat. Our next kind of category of foods to focus on is protein, right? So we had half our plate should be fruits and vegetables, and then 30 grams of protein per meal, which, especially if we're not eating meat proteins or animal-based proteins every meal or every day, this requires a little bit more just intentionality. So 30 grams of protein, especially with breakfast in the morning, can really help to stabilize our blood sugars. So that's super important, as well as really important for lean body mass retention, muscle building, um, cardiovascular health, all the things. Yeah, so obviously with proteins, we got our animal products, chicken, turkey, beef, all of those things. Dairy and eggs are wonderful. Also prioritizing things like fish, right? We talked about those healthy fats, the omega-3s from things like salmon or tuna. Those are really important for hormonal health. So definitely trying to get in at least like fish twice a week is a really good starting point. And then also not forgetting about like soy proteins, right? So that could be your edamame, great source of fiber as well. your tofu, that tempeh, soy milk. There is, or at least previously, there was kind of a thought that since soy has plant phytoestrogens in it, we thought that that would impact women's estrogen levels in the body or just people's estrogen levels in the body. We now know that the phytoestrogens in plants are different and they don't have a direct impact on plant estrogens, or sorry, estrogens in our body. So that isn't something to be concerned about for women with PCOS. We actually do have more research that shows that consuming higher levels of soy products, they were looking at more like East Asian cultures, actually had lower prevalence of conditions like breast cancer. So that's actually really interesting. So if you like soy, give it a try. If you don't like it, maybe try adding it once a week to see a difference in just like improving plant proteins and kind of see how it tastes, but definitely lots of really fun ways to make it. And then in white, we have our lentils, chickpeas, and beans. These are a group of plants called pulses, actually. I think we used to think of them as legumes, but we know they're now actually called pulses, but pulses have actually been linked to lowering PCOS symptoms as well. So there's a lot of literature on that, which I have in my references at the end, which is very interesting to see that like adding half a cup of pulses every day can actually have a really positive improvement on different hormonal levels and things of that nature to help out with recovering and balancing cycles. So very interesting. Also, really great sources of fiber. As women, we should be aiming for about 24 grams of fiber a day. We are getting more research that shows that maybe even eating like 50 grams of fiber per day could have really positive health impacts. So, looking to get small quantities of fiber throughout the day from a variety of sources is really important. And then not forgetting our whole grain products, our quinoa, our buckwheat. These whole grains are going to have great sources of fiber, be a little bit, have less impact on our blood sugars, right? Be a little bit better for hormonal health, but also can be just great ways to have that be like your tortilla or have that be your bread or whatever it is to have your grain. Carbs are definitely not bad. I know at least I've seen kind of online, there's a lot of information about PCOS or women's hormonal health and how we need to cut out carbs. And that's not true. Your body does run off of carbs and really loves carbs. So we definitely want to just prioritize maybe some of the more wholesome ones, but not cutting out any of the foods that we love, right? Maybe just changing the portion and looking at what we could add. Maybe we love white rice. So we're gonna do like half white rice, half brown rice, or half white rice, half quinoa. Maybe we're alternating instead of having white rice every day of the week, for example, or having white bread every day of the week. We're alternating. So now we're adding in like whole grain, just little changes, right? And then I did want to mention protein shakes because especially we know that there's a correlation between PCOS and IBS or different gastrointestinal dysfunction and issues. So I do understand that a lot of people don't feel comfortable like eating a full breakfast in the morning. It doesn't make them feel good. Protein shakes can be a great option to even like add that to your coffee, make a little protein coffee, right? Um, these on the screen are just some that I personally think taste a little bit better and have some better nutrition than maybe some others, but they're all pretty similar in terms of macros and about how they're gonna impact your blood sugars. And definitely didn't want to pass by without mentioning Greek yogurt, because Greek yogurt, or even now they have some of those like coconut-based yogurts if you don't want to have dairy. Um, those can be really great, just looking to make sure that those plant-based yogurts are having some sort of protein in them, right? Like we don't want to have a yogurt that um, or have a yogurt every day, right? That's going to be mostly fat and mostly carbs, just because then it can't be our protein source. So we have to be looking at adding some other proteins in. Yeah. It is also important to take a second to note that a lot of women with PCOS anecdotally talk about how cutting out different groups like dairy or different things like eggs really improved their hormonal symptoms, and that's wonderful. And just keeping in mind that it's not a one size fits all, right? And if we're having either a medical professional or somebody in our life or online telling us that we need to cut out a whole food group, like all carbs or all dairy and eggs, um, without kind of exploring more about how that's affecting our own body, we should maybe take a second and just kind of think about why that is, right? Um, because everyone's body responds so differently to different foods. And so while for one person, dairy might make them really sick or very feel inflamed because they're lactose intolerant, or maybe that's what causes a lot of their hormonal acne, that's not true for the next person, even the next person when both of them have PCOS. So the next tip to just kind of talk about is hunger management. As you can see, we got some nice pictures of some meal prep bowls. With insulin resistance or with having like higher resting levels of insulin, that is a way that your body's going to be more hungry, unfortunately. Because if we have insulin in our bloodstream, our body thinks like, oh, we need more glucose, more energy coming in order to get that insulin out of our bloodstream, right? So, having healthful snacks and meals on hand can be a great way to just more stabilize our blood sugar and keep us from those late night cravings to just eat a bunch of snacks, or maybe we didn't eat breakfast one day and so now we're really hungry when we get home from work, and just, making it a little bit easier to choose the healthful choice. So I know a lot of people love like meal prep, things like this, where you're prepping the whole meal in like in fridge safe containers, right? Maybe you're making burrito bowls like in this picture, and you make it for like 3, 4 days and then you eat it throughout the week. That's fantastic. I don't like eating the same thing every day, so I am more of a fan of things like ingredient prep, where maybe I'll make a bunch of chicken breast and I can use it in different recipes throughout the week. Or I do like my own homemade hummus, so I'll have that and then I'll cut up my veggies so they're like ready for me. Um, and just making sure that we have things to snack on throughout the week that are going to have a protein, a fat, and a fiber, right? So, the same way we want to balance out our meals, we want to balance out our snacks. So maybe instead of just having crackers as a snack, we're going to have crackers and then we're going to add hummus and we're going to add some veggies, right? Some carrots, maybe, or celery. And so we're going to balance that out a little bit more. So we'll feel fuller. It'll cause less of like that blood sugar roller coaster. Um, and we'll be able to maintain our goals a little bit better. Okay, bad diets and restriction. Always a fun topic, especially talking about anything related to women's hormonal health. Um, I think in this day and age, we get a lot pushed at us about extreme diets and cleanses as, oh, this juice balances your hormones, or this supplement. Oh, if we want to cure our PCOS, we need to be keto. And I think it's important to recognize that there is a real correlation not only between PCOS and gastrointestinal disorders, but also eating disorders or disordered eating patterns. So it's important to maintain that we want to create a positive relationship with food. We don't want to overly restrict food because we know that's going to cause cravings and guilt long term, which overall is not going to be good for our body. We don't want to hold on to that stress around food, right? Um, we want to be a little bit calmer, breathe around food, right? And we really want to focus on nourishment. So what can we add, right? Oh, this is a snack I really love, but it doesn't have a lot of protein. Oh, maybe I could add like a yogurt on the side, or maybe I could add a cheese stick or something, or maybe I could add just like little like turkey deli roll-ups or something. Or maybe I'm gonna add a handful of nuts to add some healthy fats and protein in there. Um, to kind of see like over time, like ways we can prioritize more whole foods and more satiating, wholesome foods for sure. And also understanding that some of these fad diets or extreme diets can actually worsen PCOS symptoms, especially when there's something like keto, which is designed to be done in a very specific, intentional way under medical supervision, actually, because it was created for to mitigate seizures, especially in children. So that's kind of a fun fact. Like that's what keto was intended and still is used for in the medical sense. So if we're trying to do things like this on our own, we can often cause more harm than good, especially if we already have like GI things happening as well. It's also important to note that consistent weight loss is only about half a pound to 2 pounds a week, which looking at those numbers might not seem like a lot. But if we're doing that and we do it for 2 months, right? that's already going to be 4 to 12 pounds of weight loss, right? So that could be huge. And that could be sustainable. So understanding that if someone is telling us that in order to lose weight or in order to nourish our body with PCOS, we need to cut our calories down to like 800, 1200, even for some people, like 1500 calories, that might not be enough, right? Especially for those lower numbers, but even that higher number, like depending on your body and your activity level, that might not be enough. And we could really be putting our body into that more like starvation mode, which we don't want to do. Not great for our hormonal health at all. Okay, so we'll quickly touch on movement. As with nutrition, no lifestyle change really happens like independently of others, right? So we want to focus on movement. This is just from the dietary guidelines. We recommend for all people, right, 150 minutes per week of aerobic exercise. That could be your walking, your running, your biking, your swimming. It could be taking a HIIT class. It could be dancing. It could be yoga. All of that is wonderful. And then we also really want to prioritize strength training, especially for women. Building and maintaining lean body mass and muscle is very important. It's also really important for our bone health. So we want to include things like weightlifting or Pilates, resistance training with like bands. We could even do body weight movements at home, right? We could do push-ups at home, squats, planks. All of these are great ways to really build our muscles and increase that really metabolically active tissue in our body. So we know that muscles are going to use glucose a lot better than other tissues in our body, like our fat cells or other things are going to. So it's important to really build and maintain that, especially if we're going to be doing any sort of weight loss. We really want to prioritize building and maintaining muscle because when we lose weight, that's the first place we'll lose it if we're not trying to build it. So super important. Yep. And as I just kind of mentioned, strength training is really great for improving insulin resistance and those resting levels of insulin, because we know muscle is metabolically active. It's going to use more glucose for energy than other cells in our body. And so increasing our muscle, is going to increase glucose uptake and increase sensitivity to insulin. So really important to be doing a type of movement, throughout the week that's focused on building strength, and realizing that it doesn't have to be going to like a conventional gym, right? And like pumping weights. If that's not what works best for your body or you're not comfortable doing that, that's okay, right? It could be starting with chair exercises and a resistance band and just like pulling it, and that's still going to be hitting the same muscle groups, right? Uh, so looking at maybe lower impact forms first and building up, or maybe you love strength training, so you're gonna prioritize doing more like balancing exercises as well with the strength training to really just improve overall health. A couple other extra nutrition considerations. These are more specific to PCOS in general, which I think are really just nice to touch on. The first one's going to be vitamin D. Vitamin D is something that a lot of people in general are deficient in, and then even more women with PCOS end up being deficient in vitamin D. And vitamin D is really important, not only in order for your body to absorb calcium, so like strengthening your bones, but it's also really important for our hormonal health and how our hormones are going to be produced. So that's important. Omega 3s, super important. Those fatty acids we talked about. Some great sources are going to be flax seeds and chia seeds. We do have more research that shows that having higher like intake of omega 3s over omega 6s for women with PCOS can really help reduce inflammation and reduce some of those painful and inconvenient symptoms that we talked about earlier. Talking about minerals, lots of factors go into our minerals. They're really important for our hormonal health, as with all of these other things. There is also like a genetic component to minerals, which I think is interesting. Like some people tend to just like go through certain minerals more than others. So that's kind of important to know of like maybe For example, myself, like I need more sodium than somebody else might just because my body really uses it pretty quickly. Um, and minerals are also really important to keep balancing out so we don't have high levels of inflammation as well. So, really important to get on top of our minerals. Not every blood test is going to check for all the minerals and vitamins that women, especially women with PCOS, might be deficient in, that might be something to look at supplementing. So it's important to ask your doctor about or your provider about different kind of tests that they can do. I know there's one that's like a mineral hair test, where they can check your minerals through that. There's also different types of like stool mapping tests, which kind of goes into the probiotics, but that can also tell you a little bit about like, are you absorbing and digesting all these vitamins and minerals? So those can be some considerations to ask about if you're trying to explore more. And then probiotics are a really great one, especially as we start talking about that connection between PCOS and gastrointestinal health. We are seeing more about the correlation between the microbiome in our gut, right? And like all that good bacteria and correlations between hormonal health and PCOS. So, very interesting to see that it could be that adding a probiotic not only helps your GI issues, maybe helps get you a little bit regular with those bowel movements, but also could really improve some PCOS symptoms. So, that's something to consider. The thing about probiotics is understanding that probiotics are live cultures. So, we often find them in foods like kimchi or sauerkraut or yogurts that are going to be in the refrigerated section. When we find these products or other products, like maybe a probiotic supplement, that are not in the refrigerated section, we just need to be careful to make sure that they have probiotics and that those probiotics are going to be active so that we can actually consume and absorb them. So that's important to remember. And please don't buy any of the crazy expensive probiotic supplements. I know that there's so many right now. Um, Realizing that there's foods we can get them from first, and then also realizing that we do want to supplement, there are options that are going to be just as good at a more affordable and accessible price point as well. And then I just wanted to quickly touch on a couple supplements and medications that are pretty common or I hear about a lot with PCOS and just hormonal health. Um, so the first one I wanted to talk about is inositol, which can improve insulin sensitivity, regulate your cycle, support ovulation, reduce inflammation. Some people say it reduces their hormonal acne. Seems really great, right? It is a version of vitamin B8, I believe. Yes, vitamin B8. So it is coming from a natural source. There is kind of mixed evidence on its improvements for reducing PCOS symptoms. So it seems like some people it really works well for and some people it doesn't. So that's just something to be considering. It also can come with some GI side effects for some people, right? So once again, not a one size fits all, as nothing should be with hormonal health at all, especially for PCOS, but could be something to consider or ask your provider about. The next one I wanted to talk about is cinnamon, which I feel like a lot of times we have in our homes. I love the taste of cinnamon. Specifically, we're going to talk about Ceylon cinnamon, which is a form of cinnamon you can get at the grocery store, but it's been identified to help lower blood sugars, especially like resting, fasting blood sugars, improve muscle, menstruation regularity, as well as lower inflammation. And Ceylon cinnamon comes in like the grocery store. You can get it in like the little shakers. You can also get it in like a pill form to take it as a supplement, which can be great. The one thing to note about cinnamon before we start adding cinnamon to everything is conventional cinnamon that's not Ceylon cinnamon has a little bit more of an item called, I think it's called cousermin, something of that nature. But it's a part of the cinnamon that if we were to add it to like all of our food in like tablespoon amounts every single day, it could build up and become more toxic in our body. Whereas Ceylon cinnamon does not have that. So that's the one that we can definitely go crazy with and add a bunch of if we want to. And I love talking about Ceylon cinnamon because it is relatively low risk, high reward, right? not really a lot of side effects, and could have some great positive impacts, especially if you like the taste of cinnamon. And then vitamin D, as we talked about, many women are deficient. It supports hormone balance, insulin sensitivity, menstrual cycle regulation. Um, Definitely vitamin D and iron is another good one to ask your physician about getting checked or your provider to get those levels checked to see if you're deficient, because just supplementing those two individually can make a huge improvement, as well as just like quality of overall life and tiredness and that kind of thing. Then the last two things on this list are both medications. They're both marketed towards diabetes or prediabetes care. So metformin is a diabetes medication which works to reduce insulin resistance and help. And for women with PCOS, it can help restore ovulation and regular periods. Um, so that can be a great option, especially for women with insulin resistance who are maybe in that pre-diabetic to type 2 diabetic range, can do wonders for bringing down hemoglobin A1C, really helping restore that blood sugar balance as well. And then GLP-1s those are going to be things like your Ozempic, your metformin, your Zepbound, your Mounjaro, that all came out in the past couple years, right? They've been the hot topic. Um, GLP-1s work by reducing that blood sugar as well, helping insulin sensitivity. They also have that big promoting weight loss component for a lot of people. So that can be um, a game changer for a lot of people. We're also starting to see more literature or more literature being like kind of started and investigated about GLP-1s and metformin, and their use specifically for like PCOS. So that'll be interesting in the future to see. It is really important to note though that GLP-1s specifically do come with a lot of gastrointestinal side effects for many people. So that's definitely important to be aware of. That's already something that you struggle with and are dealing with, that this might not be a good medication for you. So definitely bringing that up if the conversation comes up with your physician or your provider, weighing all those pros and cons. Which brings us to advocating with your healthcare providers, right? So I think almost every woman I know, myself included, we all have a story about a time we went into the doctor's office and we left just feeling so not seen, not heard, right? Maybe we had testing done and the results weren't explained to us, or we asked for testing and we're told that's not necessary, or we were prescribed a medication that we didn't want or ask for before any other alternatives were discussed or investigated. Maybe we came in thinking that we were going to get diagnosed with a condition and our provider just wrote us off without. Oh, wanted to let that plane go. um, but yeah, so it's important just to kind of have maybe some tips to think about when we're going into our healthcare visits with whoever that provider might be. I also think it's important to mention that not every provider we go to is going to be an expert in women's hormonal health, women's metabolic health, or PCOS, which is really both, right? In order for someone to really be competent in nutrition or in healthcare for PCOS, right, we really need to have them be understanding women's hormonal health as well as women's metabolism and how those play together. So, um, I think also giving people the grace of, oh, maybe if I go see, say, a dietitian, because I'm hoping to become a dietitian soon, right? And I'm really excited to go see this dietitian, but then she can only give me general nutrition, right? Um, that's really disappointing if I thought that maybe they portrayed themselves as being someone who's competent in PCOS, but maybe they didn't. And so we need to find like the best referral or the best person to go see about that to really get into the nitty gritty of what we want. So I think it's important to bring questions and research your appointments and your physicians in order to really stay like informed in your care. If you see something online that you're curious about, bring it in. Um, I don't think we should be afraid to ask our physicians or our medical team anything um, about supplements or different conditions or symptoms if we're not sure about it, right? As women, like we know our body best, and if something feels off, really not being afraid to advocate for that and asking for that second opinion if it doesn't feel right or you want more clarity. Um, Especially if someone is pushing a treatment plan that doesn't align with your values or align with what you perceive the issues to be or the outcomes that you want. I think it's also okay to like say no to those treatments, right? If a doctor's pushing, maybe you have GI issues and they're really pushing you to take a GLP-1 for weight loss, and you're like, that just really doesn't align with what I think my overall health goal is going to be. Don't be afraid to say no, right? And sometimes that means trying to find another provider, which I know is a real pain with insurance and with the wait times. But unfortunately, sometimes that is the best option, and maybe seeing if some offices might even have another physician who might also be in network and seeing if you could see them or something like that to make it easier. As well as it's really important to check with your insurance before appointments, as well as like while you're in the appointment, right? So if you're in for your physical exam and they're like, okay, we're gonna have some testing done, ask, is that part of my like physical? Is my insurance going to accept that? Is this medication included in my insurance? And not being afraid to push for that, because often there's things that they can do to make it better, right? Maybe they can give you the generic form of the medication, maybe providing a different dosage. Maybe your insurance is only going to cover like the 0.5 milligram and your doctor wants you to take 1 milligram. So maybe they can prescribe the 0.5 and you take twice, like two of them or something. Because sometimes it's very silly what insurance will or will not cover, right? As well as it's important to keep thorough documentation of appointments, treatments, as well as symptoms. So if you're trying to advocate for yourself and get your insurance to cover something, maybe it's a procedure that they wouldn't cover for everyone, but when you've documented for 3, 6 months about how those symptoms impacted your quality of life. You had to take time off of work to deal with these symptoms. You weren't able to do your activities of daily living, and you've documented that on paper, right? You've documented like your appointments to your doctor, your appointments to maybe you're going to see like a chiropractor, an acupuncture, or massage therapist as well to deal with these symptoms, and you provide all of that to your insurance. They're often much more likely to cover that procedure or partially cover it. So that can be a great way to really advocate for your health as well. So as we're on virtual, we don't really have questions, but feel free to add them into the comments, or you can reach out to Virginia Cooperative Extension and we can get back to you. Any questions you might have. Here are some of my references. Some of them are also linked throughout the slides, but thank you so much for joining us on this Zoom. Feel free to scan this QR code if you could and just fill out a little survey about the class to see if it was impactful, if it met your needs. But really appreciate your time, and I hope you have a great rest of your day.